Do your eyes constantly feel dry, gritty, they water or get irritated no matter how many drops you use? These symptoms might be more than just dry eyes. They could be signs of an autoimmune condition such as Sjögren syndrome or many other conditions. These conditions can often go undiagnosed. Welcome to today's video. I'm Dr. Ayesha, but thanks for tuning into our channel. With July being National Dry Eye Awareness Month, there's no better time to talk about the connection between autoimmune diseases such as Sjögren syndrome, dry eye, and long-term eye discomfort. In today's video, we'll cover the real, evidence-based causes of dry eyes, from autoimmune diseases and hormonal shifts to medications and even LASIK eye surgery. Let's begin with autoimmune diseases, one of the most overlooked causes of dry eyes. First, there is Sjögren syndrome, a condition where body's immune system attacks its own moisture-producing glands, like the lacrimal glands that make your tears and glands that produce your saliva. So dry eye and dry mouth goes hand in hand. But Sjögren's isn't the only culprit. Others include rheumatoid arthritis, lupus, psoriasis, systemic sclerosis, and thyroid eye disease. These conditions can cause inflammation and damage to the tear-producing structures, leading to either not enough tears or poor quality tears that evaporate too quickly. Now, let's talk about something millions of people use every day: medications. Did you know how many prescription and over-the-counter drugs can reduce tear production or change the tear film quality? Antidepressants are also notorious to cause dry eye. We don't know enough about the dry eyes and its relationship, but we'll love to discuss that with you. Next up is hormones. Women, especially during perimenopause and menopause, experience a drop in estrogen levels that affects the stability of the tear film. Other hormonal issues can also be factors: thyroid dysfunction like hyperthyroidism or Graves' disease, diabetes, and insulin resistance, which affects the corneal nerves and tear film. If you are experiencing hormonal changes and dry eyes at the same time, this could be a key connection. If you had LASIK or PRK surgery, you may have noticed drier eyes afterwards. That's because these procedures can cut corneal nerves that help stimulate tear production. Especially first 3 to 6 months after the surgery can be a little challenging. In most people, this dryness improves over time, but in some cases, it can become chronic. Now that we've talked about the causes, let's quickly go over how we diagnose dry eye. In our clinic, we use several advanced tests to figure out exactly what's going on. These include tear osmolarity testing. It tells us how salty and unstable your tears are. Tear breakup time. It helps us how quickly your tear film evaporates. Yellow and green staining, called fluorescein and lissamine. It highlights the damaged and dry surface on your eye. Meibomian gland imaging. It shows if your glands are degenerated, clogged up, or are they shrinking. Last but not least, a Schwimmer's test, which is literally a piece of paper that goes in your eyes to find out how quickly it can get wet. So, getting an accurate diagnosis is the key to finding the right solution. Here's the big takeaway. Dry eye isn't just one thing. It can come from autoimmune issues, hormonal shifts, medications, surgical history, or combination of all of these. That's why it is so important to see a provider who specializes in dry eye diagnosis, like we do here at Texas State Optical. If you have been struggling with discomfort, light sensitivity, or blurry vision that fluctuates with your blinking, let's find out what's really going on and get you on the path to lasting relief. And don't forget to subscribe for our next video, where we'll go over the best treatments for dry eyes, from home care to in-office procedures like IPL, radiofrequency, and tear care.